Hello, everyone, and welcome to the Common Ground podcast by the Howard Thurman Center. My name is Celeste Hamre.
Hi, I'm Amanda Dowd.
Hello, my name is Issa Kenyatta.
And I'm Alhassan.
And we have a very special guest on today. We have Sophie Godley, who's a professor in the School of Public Health. Hi, Sophie.
Hi, everyone.
We're really glad to have you on today. And as a side note, I know that Issa and I, we were teasing everyone about who the new host was. So Celeste, welcome. We're very excited to have you on.
Thank you for having me. I'm excited too.
So why don't you tell everyone what we're talking about today?
Sure. So the topic of the night is very current. It's about Ebola. We're going to kind of outline the epidemic, talk about it in context on the international sphere, but also here in the United States. We're particularly interested in social reasons behind reactions to Ebola, the differences between reactions in the U.S. versus abroad. I'm just going to get a conversation going about this current public health issue.
Yeah, absolutely.
All right, so I think we're going to start with the timeline of the outbreak so far. So in the spring of 2014 is when we first saw a few cases of Ebola, and I was wondering if, Sophie, you could talk a little bit about the start of the outbreak and kind of the spread and the areas affected?
Sure. So the most interesting thing to make note of that a lot of times people aren't aware of is that we've had Ebola for decades. Mm-hmm. And what's different, what changed over the summer is that we suddenly had Ebola in urban areas in West Africa. And previously, we'd really only seen Ebola, first of all, in Eastern Africa, so it moved nearly 3,000 miles. And then secondly, it was an urban transmission as opposed to rural. And so that's a really big change. I can't emphasize enough how bizarre it was for us to suddenly see this disease in urban areas. And it kind of changed everything that we had previously thought, which basically if you have a terrible epidemic, but it's in a rural area, it tends to die out pretty quickly just because the transmission links break. Whereas if you're in an urban setting, you're just in contact with many more people, and those people are unfortunately more likely to become cases themselves and then spread, and so you just see these much higher peaks of an epidemic.
Right.
What do you think about the jungle climate in these areas? I'm just kind of wondering if there's a link between global warming and increasing climate change that might make this transition happen. I know, especially with jungle climates tend to be kind of more hotspots for Ebola outbreaks. I was wondering if you had any thoughts about that.
So I can't comment really directly on the climate change impact, other than to say we do think so Ebola is an animal vector disease. So it is spread human to human, but it lives in, we believe with this current outbreak, what we're really looking at is bats and transmission through fruit bats. And the reason that we think that is because those are animals that move that span. So very few animals migrate 3,000 miles, right? Whereas these bats do. So we think that might be part of it. And I don't know if those migration patterns have changed, Celeste, because of the climate change. So but I can't speak to that directly. That's a little bit out of my area of expertise.
Yeah. So I have a question. I think that we're seeing kind of a lot of fear and hysteria, and it wasn't until really just the last couple of weeks that I personally realized that this is very specific to the States. I had a friend who was telling me that the media coverage of this in England, for example, is completely different, and it's more of a, this is happening, it's terrible, we're sending help, don't worry guys, we're all going to be okay. Whereas here you have everybody kind of freaking out about it. Why do you think that hysteria is happening, and how can we combat it?
Well, it's a great question, and I'm usually the first to blame the media and blame, sort of, American culture for our inability to accurately perceive risk and our inability to sort of focus on the things that are really going to hurt us as opposed to things that just scare us. But I have to say, I actually have a little bit more empathy with the fear around Ebola. Ebola is terrifying. So I don't think we do any good to pretend that it isn't. Like, it is a really scary, terrifying, sort of viscerally fearful virus. But the problem is that we're not good at judging risk. We're not good at sort of looking at, okay, these are the things that can really harm me, and these are the things that I should be focused on. So you've got this bad combination, right? So we're not good at judging risk. Then there's this really scary disease. And then there's, like, frankly, really bad communication from public health officials. So I think some of the public health officials who responded had a lot of hubris, and they made a lot of mistakes in some of the things that they said. And there's nothing that kind of turns the public sooner than, having to come out and say, oh, well, I guess we made a mistake. Like, well, you may as well not say anything after that, right? So, the CDC should never have said, oh, we're not going to have any transmission on U.S. soil. Well, of course we are, right? If we don't put things in place, if the protocols aren't followed, then why would we be any different than, Medicine Sans Frontières in Liberia, right? So they've had healthcare workers become infected as well, and so have we. So I think that was a piece of it. I really think the CDC mishandled it, and I think they sort of, they didn't come right out and say, yeah, this is this awful thing. It is so unlikely that it's going to come anywhere near you, Mr. Human walking down the street, this person living in your home, right? But why don't you go get a flu shot? Like, getting a flu shot would be a really good thing to do.
Yeah, Sophie, I completely agree. I think when it comes to the media, it also comes with the idea that, you have to get ratings, right? So what's the hot topic right now? What can we keep people captivated with? And that's through fear. Sometimes that's the way you keep people listening to that 24-hour broadcast. But my question is really in regards to, like, we hear a lot about, okay, Ebola, how it's contracted and things. But if we could just recap exactly what does Ebola do in the body, or exactly what does it attack in a sense that makes it so deadly?
Sure. So Ebola is what's called a filovirus, and we only have there's really one other of this type of hemorrhagic fever virus, which is called Marburg, and we've also seen outbreaks like that happen again mostly in Eastern Africa. And the fear factor comes from the fact that when infection takes hold in the body, and when someone starts to become really ill, there's some really scary, nasty side effects, right? So you're very prone to, extensive projectile vomiting, extremely bloody, terrifying diarrhea. So there's just a ton of fluid, and that's at sort of the end of the course of the illness. So that's not what you get in the first few days. That's when you've been sick for many days, and you haven't had any sort of care to rehydrate you or, sort of keep you comfortable. And, there's some things that we can do. And this is why we've seen, a very different case fatality rate in the very few cases that we've had in the States, right? So the healthcare workers who've been infected in the U.S. or the healthcare workers that have been lucky enough to be transported to the U.S. have, for the most part, survived. Whereas the case fatality rate in Liberia is 1 out of 2, right? So most people die, or huge number of people are dying who contract the disease, and that's because in a healthcare system that's completely overrun and that doesn't have the resources, you can't do some of those very basic things like just rehydration, which is huge, right? So rehydration, literally keeps people alive. It also, one of the cruelties about a hemorrhagic fever is that with fever, you have natural dehydration, right? So that's one of those things, right? You get a fever, you start to dry out. Then you add on top of that vomiting and diarrhea, and it's like literally the body just sort of collapses.
Yeah.
Do you think we actually have reason to be afraid of Ebola? Realistically, do you think anyone's going to actually be impacted by the Ebola disease here in the United States, other than the couple of cases that we've had so far?
No. I don't think anyone is going to get infected who isn't in direct contact with very sick people in a hospital.
Yeah.
So, unlike what's happening in some of these areas in West Africa, anyone who is so sick with Ebola that they are transmitting the virus is not going to be, literally cannot walk down the street.
Mm-hmm.
You know what I mean? So it's not going to be in the air. It's not going to be somebody that you come in contact with. I heard yesterday from an infectious disease doctor, and this is horrifying, right? So I don't mean to, I'm not at all trying to be casual about this, but, Thomas Duncan was literally melting. He was so sick, and there were piles of bloody diarrhea and vomit all over the room that he was in Texas. And the nurses who were exposed to him, we're not talking about a finger swipe of vomit, right? We're talking about incredible volumes of sick and deadly fluid, right? Infected bodily fluid. So no, that is not going to happen to the average person walking around.
Right.
The conditions in the United States are so unlike that. It is so unlikely that it could happen here.
Yeah.
I was also very struck by the fact that, granted, we've only had a couple handfuls of cases in the U.S., but the survival rate is very high because, people who have been infected are getting the appropriate care and they're being, properly hydrated. They're in hospitals. So having 8 out of 9 people live is, a really great percentage so far. And I just can't help but think, obviously I don't think that it's going to become a problem here, but even if we did see more cases, I can't help but think that they're going to survive most likely just because we have the resources to treat them.
Yeah, and don't forget too, the way that infections like Ebola work, well, any contagious or any of these types of diseases, the condition that you are in when you first acquired the disease also can make a huge difference, right? So if you're an otherwise quite healthy person who's eaten well, who, has doesn't have any other underlying issues or conditions, your body may be able to sort of withstand an infection like Ebola, especially if you get the supplemental care that we're able to give people in the States. So that's also part of it, right? So case fatality is also about sort of how were you before you got sick, right? And then the second piece of it is that, I think that the care that's being given in this country, the other thing that seems to make a huge difference is how quickly we can get you into that care. So the tragedy with Thomas Duncan is that he presented in the early stages of his disease, right? But was, allegedly or apparently anyways, turned away and not given care until he was much, much sicker.
Yeah.
So with healthcare workers who are potentially exposed to someone who's sick, chances are we're going to get to them super quickly. Does that make sense?
Yeah, absolutely.
And so, before the virus has before they've gotten to the point where they're in an absolute medical crisis, we can be giving them medication, we can try to keep their fever down, we can, make sure that they're resting, and, all of those sort of silly things that actually at the end of the day seem to make a big difference.
Yeah, and I think that, in the United States having these healthcare options has really made the difference, but it's really disheartening to see how the media is portraying or how people are portraying, especially in Houston comes to mind, of course, pretty fast. Ebola kind of being issue for Africa. They're kind of making Africa seem as one country, opposed to saying, where have we seen it or not. There's an issue with a student who was studying abroad in, I forget which country, but a country that has not had cases of Ebola yet. And I can't help but feel like there's some racist underlining of this. I'm not quite sure. I'm just wondering if you have any thoughts on that.
Yeah, I mean, unfortunately, I absolutely agree. I think that there's, I mean, I'm the first to usually but I'm certainly not someone who's afraid of calling out things that I think are racist. I actually think this is a little bit more complicated. I think it's both racist and xenophobic. So it's got sort of some good old-fashioned, U.S. anti-immigration pieces of it, right? Fear of, the other, fear of the unknown, fear of different, that kind of stuff. So I think that's part of it. And then I think there's this general kind of, when people get afraid, I mean, we've seen this with plagues and epidemics for, as long as humans have kept these kinds of records, right? That whenever there's a plague or a virus or something that people are afraid of, one of the first things we like to do is, blame it on people that we don't like or blame it on people that are different from us. Even as recently as the so-called Spanish flu of the early 1900s, which probably started in the United States, right? But we call it the Spanish flu.
Right.
So we've seen patterns like that, and it's just, I think, unfortunately, it's a really typical response.
Yeah, and I feel like something that kind of bothered me was over Halloween, like, Ebola became this huge, like, costume design or costume idea, right? To be the Ebola patient, to wear, like, all this interesting garb. There was even a costume that was, like, the sexy Ebola patient. Oh, and it's like, I see things like that, and I'm like, wow, like, how... It's interesting how we can make light of something like this, and not even think about people who actually are dying in like Liberia, like who are actually being affected by this, and we make light of it, and that's what really bothered me. And when I talk to some of my friends who are African or come from Liberia or any type of country in Africa who are at BU, it's like one of the first things that people started asking was like, oh my gosh, like Ebola, how does this impact you? Or like just because they're of African descent, Right. So yeah, like I definitely agree. I think there's a lot of social issues that come along with this, as well as just being a disease that's causing like fear into people. So.
Right.
Yeah.
Right. Well, and I'm always kind of amazed and stunned and horrified by a lot of things that people think are funny or really bad choices that people make around Halloween costumes and. I feel like part of the joy of living in 2014 is social media and having access to, pictures that you wouldn't otherwise have and having Instagram and Tumblr and everything. And sometimes there's some really great things that come out of that. And then sometimes I think like, wow, I really didn't need to see that. And, 10 years ago, I would not have seen that.
Yeah.
Right? So I don't know. It's almost like we have to get better at, just calling people on their nonsense and, remembering that there's a real problem with equity here. And it is wonderful that the nurses who treated Thomas Duncan lived. And it is also stunning to think of the money and the resources that went into those two cases. And to compare that with, people who are dying in Guinea or in Sierra Leone or in Liberia who could use, even an 18th of the money that was spent here. Yeah. So to me, like, I don't know. This is just my perspective, and God knows I'm not the queen of this, but I'm sort of like, I don't know. I guess I just feel like let's let the costume people. They're just stupid, and we can just, I don't know. In some ways, I feel like we can sort of write them off like those are just people being idiots. Right?
Yeah.
The harder stuff to tackle is what do we do about this equity stuff? Like, what do we do about the fact that if you live in Houston or you live in some of the missionary doctors who were taken out on private jets from Liberia. One quote I heard was that there was over 20 nurses and 5 doctors per patient.
Yeah.
Right. Yeah.
Which is
that's
amazing
kind of
for
a
those
stunning
patients.
thing to think about, right? So
Yeah.
Yeah, and just kind of as one last question, we're interested in the quarantine right now and kind of this idea of, this Ebola hysteria we have going on, and then having public relations professionals kind of make public health choices. Mm-hmm. And especially with the New Jersey, kind of New York, making these decisions that it's misleading the public even more about Ebola.
Right. Yeah, it's a really fascinating conundrum. So we're always more willing to accept restrictions on our freedom when we're afraid, and it makes for a really dangerous dynamic. So politicians suddenly make much stronger and more intrusive kind of restrictions on people, and the public seems to be pretty willing to put up with it, because of the fear factor. So I'm kind of in love with the nurse in Maine who is just look, this is not based on science. I am not sick. I'm not licking people in my town of Maine. I'm going to go for a bike ride.
Yeah.
And I just feel like her brave faith and her ability to just kind of be like, this is not science, is just wonderful, It just kind of cuts through all of the nonsense that the politicians have done. Now, at the same time, I have to say, I don't feel like the doctor in Brooklyn did us any favors, I think some of the choices that he made about going on the subway and going bowling and some of that stuff just seems a little bit to fly in the face of some common sense.
Yeah.
So, I think that was unfortunate. And, I'm glad he's doing well. I'm sure he's going to be fine and all of that, but it's really tough, right? So then New Yorkers get this sort of spectacle, right, of healthcare workers in hazmat suits scrubbing down a bowling alley, which is just crazy. And at the same time, it's maybe he could have made some better choices as well, So, I don't know.
Yeah, well, thank you so much for joining us tonight. I think it was a great conversation. Hopefully, we won't see any more cases of Ebola in the United States, and more importantly, we'll get some more help in Western Africa and areas that have been detrimentally affected.
Yeah, and thank you so much, Sophie. I think it's so important that we have people who are professionals in the health field who are getting this information out there to people who are just, like you said, looking at this stuff in fear and not really understanding it. And definitely a special shout out to the heroes out there who are battling Ebola and see this for the decades that they've been working on it in these infected areas. So it's definitely a brave and heroic task. So
yeah,
Super.
Thank you so much.
My pleasure, and thanks for doing this.
Yeah, thank you. We really enjoyed it.
Thank you for having us.
Okay.
All right. Thank you so much for joining us tonight. And this has been the Common Thread, the official podcast of the Howard Thurman Center. I'm Amanda Dowd.
I'm Issa Kenyatta.
I'm Alhassan.
And I'm Celeste Hamre.
Thank you and good night.